Tonight, new COVID-19 cases in Tennessee are back on the rise.
Just within the past 7 days, we have seen an uptick in positive cases, but health experts say the increase is not like what we saw this time last year.
WATE 6 on Your Side reporter Kirsty Crawford joining us now. So, Kirsty, I understand local experts say this trend could continue.
That's right, Bo. So, before we go any further, let's take a look at what we're talking about. So, this graph you see here on the screen, this is from the State Department of Health's website, keeping track of new COVID-19 cases. This peak that you see here in the middle, that's from mid-December. But let's take a look over here on mid-June, or we have May and June over here. You can see that trend does go down, but they are going back up now. We are seeing more cases here in Knox County, too. The Knox County Health Department of Health reporting a 39% increase in active cases from last week to this week. The lead epidemiologist with KCHD tells me why we're seeing the rise in cases. This time last year is when we really saw COVID-19 cases start to spike in the state. Drive-through testing was needed, and bars were facing another closure. But this summer has looked different so far.
We had several days where we only had 1, 2, 3 cases. We got our average weekly case count down to about 5, which is phenomenal.
That's until recently, but people are gathering again.
Some of it's coming from places or events where people tend to gather. We're also seeing a lot of people, a lot of our cases that we're talking to are saying that they've traveled recently.
Roberta Sturm says, fortunately, the rise in cases now is nothing like last year.
This actual week last year, we broke 100 cases in a day, and that trend just rose so incredibly fast. What we're seeing this year is we're seeing a fourth of that number of cases.
She says there's several reasons behind that. Even with the variants out there, 45% of the county being fully vaccinated helps.
We have a very effective vaccine. We have experts that understand a lot more about this virus. We have a lot of people in the community that are helping provide vaccines and education around COVID, and our community knows what to do.
However, Sturm says the increase most likely is not over. We could possibly see this trend continue for the next few months.
Now, I will say with things like school starting back and university students coming back, you're taking a lot of people and putting them in one close environment. So we expect those cases to increase, but we've also put a lot of things in place to make sure that we're prepared to handle that.
Now, we also talked about the Delta variant. Roberta Sturm tells me that variant accounts for about 20 to 30% of the samples collected, but the UK strain is more prevalent in our area. That makes up about 40 to 50% of all of the samples. She says the vaccine has been effective against all strains so far. Bo.
All right, Kirsty, thank you. And the epidemiologist who we just heard from says the COVID-19 vaccine is very effective, but again, not 100%. That means some vaccinated people can still get the virus. However, she says it's important to get the vaccine because it will help prevent a serious case. Now, since the beginning of June, 11 Knox County residents have died from COVID-19.